So what was the very first thing you did when you went into work today?
Well, today was a surgery day, so the very first thing I did when I went into work is went to the pre-op area where the patients go before their surgery, and we had some physician assistants over there that help us. We all sit together and kind of talk about what cases we're going to do that day, and then we go see the patient who's waiting.
How many surgeries do you typically do on a given day?
So it depends what kind of surgeon you are. If it's a really big case or a really serious, very involved case, you might end up only doing one case a day if it takes 12 hours. But for the cases we were doing today, they're all very small hand cases, so for hand surgery. And so each case, some cases might only be 15 minutes. So we did 12 cases today. Some days when we have surgery days and are doing more, like I said, more involved surgeries, like if there's a patient who has a really bad cancer, and let's say the orthopedics team is going to take out the cancer from the leg, then that might be a couple hours for them to do that. And then they call us in and say, okay, the tumor's out. Time for you guys to come move some tissue here and close this big hole we made. So then we come in, and now it may already be noon at that point. And so on those kind of days, our surgery day may be just one person we take care of, and it takes us then a couple hours to close that hole that they made from the cancer. And so on those days, we might only have one surgery. But today, it's at what's called an outpatient surgery center where people can come, their family brings them. They come in, and then like a small case, like if someone has carpal tunnel syndrome, it's a very small incision on the palm of the hand. It takes about 10 minutes to do it. You just make a little cut and release the carpal tunnel. That only takes us about 15 minutes. So we can do multiple people very quickly for that surgery. So that's how we got in 12 cases today. We had a lot of little cases that were like that.
So now I believe I'm familiar with carpal tunnel, but for anybody that might not be, what exactly is it?
So carpal tunnel is where you start having symptoms of numbness and tingling in your hand from that nerve that innervates your hand being kind of smushed in there. It gets really tight in there. So the way you release it is by opening the roof of the tunnel. And the roof of the tunnel is in the palm of your hand. So we just make an incision over the palm of the hand. It's very small. And it opens the roof to the carpal tunnel itself. And it allows the nerve breathe, so to speak. It gives it room to wiggle around. And it's not compressed anymore. And so then people's symptoms go away almost immediately.
So now I have a question about the example you said before about somebody having cancer in their leg. Is that typical where you'll have one surgeon or one surgery team do part of a surgery and then another surgeon or team comes in and does another part? Is that typical or no?
So usually most surgeries you can do start to finish by yourself. So if you're a general surgeon and you're taking out someone's appendix, then you take out the appendix and you close. It's as simple as that. But there are some surgeries that when people are really sick or have really complex problems, kind of the hole that is made in the body to get out the bad stuff like cancer or the tumor, whatever it may be, becomes too big to just close the skin and be like, okay, we're done. And so if that's the case, for me specifically, my experience is that's when you call a team like your plastic surgery team in to come help you close a giant wound. So in my experience, we work a lot with cardiac surgeons and thoracic vascular surgeons, orthopedic, ENT, the head and neck surgeons. And when there's a hole that they make taking out something really bad, they can't just close the skin back up because it's too big. They call plastic surgery to come help them close that hole. So we have some creative ways to move tissue from one part of the body to another. And it can be quick or it can take 10 more hours. So for me, it's very common to work with other surgical specialties. But in general, being a surgeon of other flavors, you don't generally have to work as a team with other people always.
So you said you were at an outpatient surgery center today where the surgeries were going to be fairly small, like in and out patients. Is that always how it is? Are you always there, or do you do surgeries at other locations?
So what we do is on our surgery days, we have different kind of locations. So if you're operating at a main hospital, that's where those big tumor surgeries are going to be. And so those days are different than days like today. Today was at an outpatient surgery center. So like I said, people's family drives them in. They walk in to get their surgery, and then they usually walk out a couple hours later feeling great. So the kind of cases we do there are much smaller. So for instance, today we did a handful of carpal tunnels. We did a couple broken fingers today. So people got their fingers jammed at work under some boxes and, car doors and things like that. So we had a couple broken fingers that we pinned and one distal radius fracture that we put a plate on the inside of. But those cases generally take, anywhere from 30 minutes to an hour. So they're pretty quick too, all things considered.
So now I've heard of people getting things like pins and plates put into their bodies, but how exactly are they used? Like, how do they work, like, in the body?
So it's exactly like carpentry and building a house. You know, if you think of bones as wood, and now, of course, it's not the same stuff you use to build a house. This stuff is all sterile and made for the human body. But the analogy is that if you think of it that way, that's essentially what orthopedics is putting bones back together. And hand surgery is a mix of bones and the soft tissue and all the other stuff in the hand. But if someone has a broken bone, you can either fix it closed without even ever cutting open the skin, or you can cut open the skin and go down to the bone where you actually see the bone and put all the pieces back together, and then you use a plate with screws to hold everything together, just as though you would put, two pieces of wood together and then put a plate on it and screws through it to hold it together. So it's kind of like carpentry, but for bones in the body. And the pins are these long silver they almost look like the angel hair pasta before you cook them. They're really skinny and they're sharp, and you use what looks like a drill, and this drill thing takes the pin in it, and then you push the pin through the skin without ever cutting the skin with a knife. And you can see on your x-ray machines then where your pin is relative to bone, and you can kind of pull on the bones and get them aligned back up, and then drive the pin through those bones to hold them in place. Pinning is a good way to fix some simple fractures without opening the skin and doing open surgery.
So you actually have an x-ray machine with an x-ray technician next to you while you're doing this to kind of make sure the pin is going into the right spot?
Yeah, so you wear a lead apron underneath before you wash your hands and become sterile. And so you wear the lead apron to protect yourself. And then you sit at your operating table, and the person's hand is out on the table. And then there's a machine that an x-ray tech kind of pushes in and drives the machine. There's a screen on it, and they can take pictures as you're working. So you can put a pin, align it up outside the skin, and then say shot. And when you say shot, they take the picture, and on the screen appears the pin sitting near the finger or hand or whatever you're fixing. And so you have a live image to watch while you're fixing the bone. And you can use that too with open fractures and putting plates on so that you have live x-rays as you go.
Do you always need pins and plates and things like that to fix broken bones, or no?
So it depends who it is that broke their hand. Is it a kid? Is it an adult? Is it a famous piano player who needs their fingertip, or a violinist who needs to make sure that little distal end of their tip, flexes just right on their violin? Or is it someone who works out in a field and just kind of needs to use their hands grossly to hold a hammer? It all depends on who it is and how bad the fracture is and what their demands are. If it's someone who's very young or elderly, obviously in the elderly, you can get away with letting a little bit more go because the demand on their hands, being that they're so much older now and their lifespan is a little bit shorter, is going to be a lot less. So you can still fix a lot of fractures that aren't that bad, aren't blown into 3 million pieces and open and bleeding. You can fix a lot of things by just reducing it and then putting it in a cast, or just putting it in a cast, or putting it next to the other finger and letting them kind of bend together to keep it from becoming deformed. You can do that. It's just a matter of each person's different and each fracture is different.
So now this is a question just because I'm kind of a handy guy. I like building stuff, but when you have to use screws on patients' bones, do those have to be pre-drilled, or do you guys use like self-tappers?
Yeah, you pre-drill them, especially for like the orthopedic side. There are some screws like for facial fractures that you don't have to pre-drill. Those screws are really small and they're self-drilling or self-tapping. But yeah, you use it's just like woodworking. You use an actual drill, and you drill the hole, and it's lined up, and then you put the screw in it and you put the screw down.
So now, even though you have lots of experience under your belt, you're still in the fellowship phase as far as hand surgery specifically. So you still need to have a senior doctor there. Is that correct?
Right. So when you're a resident and even a fellow, most of the time it's a little bit different fellowship because you're done with residency technically. But to keep it simple, when you're a resident in training, there's an actual fully certified staff surgeon who's there with you. And they're letting you do parts of the case, but they're right there standing next to you, either assisting you or watching you and making sure everything is going perfectly.
So they're just kind of there to just watch and make sure everything is going okay.
Yeah, I mean, these are their patients still ultimately, right? So the patient comes to clinic to see Dr. X, and you're working with Dr. X. They're not there to see you. They're there to have Dr. X do their surgery. And everyone who comes to a place that has a trainee knows that the trainee is going to be working with them in the OR, and they understand that and they're agreeable to it. They know that that's how life works. But Dr. X is still who they want doing their surgery ultimately. So even if it's a simple surgery, they may be just retracting the skin and saying, cut here, and you're cutting there, because you know what you're doing too. But they may just be retracting for you, or they may be doing the surgery if it's a complicated one, and you may be retracting the skin for them. And you may be just watching and learning, and they may be showing you tips and tricks as they go. Just depends on how complicated the case is, but they're always there.
So what determines your schedule as far as where you're going to be each day, like whether it's in the clinic or in the hospital or in an outpatient center? What kind of determines that?
Yeah, so everyone's different. It's totally the preference of the doctor and the group, the hospital they work for. Some people like to split their day where they see patients in the clinic in the morning, just like a normal doctor's clinic that they work in. And then in the afternoon, they'll go to their surgery area and they'll do surgeries in the afternoon and then go home. And then other people like to have it blocked off where one whole day is clinic and one whole day is surgery. For us, we usually do it that way. One whole day is surgery. And so today was at our surgery center, and it was an entire day of just surgery. And then when we were done, that was the end of the day, and we came home.
Now, who normally makes that decision, though? Is it normally you, or is it your boss, or?
If you're lucky, you get to decide it. Usually the hospital tells you what days they have availability, and then you work around the hospital usually. But if you are lucky and you work for someone or work for yourself and have the ability to say, this is what I want, and this is what I'm going to do, then it's up to you. But usually when you join a group, they tell you, here's what we have open, this is what your schedule is going to be, kind of, and you get a little bit of say to tweak things, but you usually don't get to just do whatever you want whenever you want. Each week is pretty predictable, and so like Mondays are your clinic day, Tuesday's my operating room day, Wednesday's my research day, and Thursday is my clinic day at another place, Usually it's pretty set where week to week, you're usually it's a pattern, you go back to the same places.
So the hospital that you work for or the group that you work for will kind of know in advance, like, hey, you're going to have to do surgeries on this day, clinic on this days, and then you have a little bit of wiggle room to adjust it as you need.
Yeah, and that conversation you have when you're getting hired. So it's not like something that changes week to week or necessarily month to month. It may change year to year, but when you're shopping around for a job and you're getting hired by either a private practice group or a hospital or whoever you may be working for or working with, that's the conversation you have when you're getting your job to make sure that the schedule they want you to do or have available is something you actually want to do. Because if it doesn't fit what you want, then you keep looking for another job somewhere else.
Do they ever say like, okay, we want somebody to work just night and weekends, or is it kind of never that ridiculous of a request?
It could be that ridiculous. If you were a trauma surgeon, you could get something like that, because they would say, hey, we have trauma surgeons that work during the work week, like older trauma surgeons who are well established, who don't want to work on the weekend and don't want to work nights. And so some hospitals might put out a job listing looking specifically for a trauma surgeon who can work on the weekend or who can work at night. So that may be something that exists, but at least in my field, plastic surgery, hand surgery, most cases are elective in some sense, or at least we try to keep it that way. So there's no specific job for that where you just work at night or just work on the weekend.